checked my physician's orders and my lab results, so I know that I'm okay to go ahead and resume with the NG tube. Alright, hello. I am Erica. Go ahead and state your name and date of birth for me. Thank you. Do you know where you are? Can you tell me? Thank you. Alrighty. We're going to go ahead and get you started with the NG tube. NG tube, I'm going to go ahead and wash my hands for you. And then hand hygiene. Let's go ahead and make sure we have all of our equipment. We have our emesis basin, our lubricant, our NG tube here. We have our tape, our gloves. Alrighty, go ahead and put these on. Have you had an NG tube done before? You have? You remember which nostril you used? The right one? Okay. Have you had any nasal trauma? A deviated septum? No. Nasal surgery? No. Alrighty. I'm going to go ahead and assess you. I'm going to check your nasal cavity. Let's let this down. Alright, your oral cavity looks good. Right, I'm going to go ahead and auscultate your abdomen. Let's pull this up. Alright, everything sounds good. I'm going to go ahead and palpate the abdomen. I'm feeling for distension or any tenderness, any pain? No? Alright, good. Alright, we're going to get your NG tube done to clear out your stomach and to start your feedings. I'm going to put this towel across your chest so I don't get anything on you. Alright, here's your tissue. Go ahead and blow your nose for me. Thank you. I'm going to discard that in the trash can. Alright, I'm going to have you blow through each nostril so I can see which one has the greatest airflow, and we'll use that nostril. Blow for me. Thank you. Blow for me. Thank you. Alright, that right nostril seems to have the greatest airflow, so we're going to go ahead and use that nostril. My tube looks pretty good, so I'm going to go ahead and I'm going to measure this for you from the tip of the nose to the earlobe, and then the earlobe to the xiphoid process. So about right there. I have my Sharpie, so I'm going to go ahead and mark this spot. Alrighty, I've inspected the tube for extra flaws or anything that's wrong with it. Alright, we're going to go ahead and start. Let me sit you up some more. Alrighty, I'm going to have you flex your neck back. Alrighty, I'm going to lube my tube about the first 3 to 4 inches. Alright, I'm going to start inserting this tube, and when I get to your oropharynx, I'm going to give you some water to sip. Alright, if you have any discomfort, just raise your left hand for me, and I'll sort of pull back, just, choking or gagging or anything. Alright, so I'm going to start. Alrighty. Alright, the tube isn't coiling up in his mouth. I'm going to give him this water to sip. Alright? And as he sips, I'm going to, as he swallows, I'm going to advance the tube with each swallow. Alright. Swallow for me. Swallow. Swallow. Oh, okay. I'm going to pull it back a little. Let my patient rest. Feeling okay? Alright. I'm going to give you some more water and we're going to try to advance the tube again. Alright, that feels good. I'm going to go ahead and temporarily take this to your cheek so that I can verify my placement. Oh, it's not sticking. Alrighty. So now I'm going to, now that I've secured, alright, that seems to stick. Now I'm going to draw up 30 milliliters of air so that I can push this air into his tube to verify the placement. I'm going to expose your abdomen. Going to kink my tube. Stick this in there. Alrighty. Alright, we seem to be in the right spot. Now I'm going to draw back 5 to 10 milliliters of your gastric contents. This just wants some stick. Alright. 10 milliliters. Now I'm going to see what the pH of this is. I'm going to put it on my pH color strip test. Right, your pH seems to be about a 4, so that's good. If we had a physician's order for a chest x-ray, we would do our chest x-ray, but we auscultated the abdomen. We're going to cover him back up. Alright. We're going to hook this up to suction. Intermittent suction is up there, and now we're going to secure his tube on his nose. You still feeling all right? I'm going to wrap these hanging pieces around here. Feel okay? Going to We're not going to take this to the towel. I'm going to take this to your gown. Alright, have some tissue here. We're going to clean you up. Now we're going to perform our oral hygiene. So in this cup I have a little bit of mouthwash for me. Get that out for me. Thank you. I'm going to leave you elevated, but I'm going to lower this down for you just a little. Going to remove my gloves and perform hand hygiene. And I'm going to document everything that I did. Alright.